So here's just some information about the steroid injections. Okay? And there's tons of different types of steroid injections. There's the facet joint. So this is a degenerative spine. We're looking at the lumbar L5-S1. You see how it's bone on bone. This is called the foramen. And so your doctor, your spine specialist will talk to you about your foramen because that's the channel that the nerve travels out of. Okay? So this foramen down below here is much, much smaller. Okay? So that nerve traveling out of that foramen has a lot of trouble. Fortunately, most of the time this happens very slowly over many, many years, decades. And if the nerve has been squeezed gently over many, many years, it kind of gets used to living in a small shoe. Okay? And it can take it. But anything that disrupts that, all games are over. The leg starts to hurt you now. Okay? So people come into me and they've got their spines, the whole spine looks like this. And they'll say, Doc, I was doing great up until 6 months ago. But 6 months ago, I fell off my porch and I landed on my butt. And ever since then, my back's been killing me. Okay? Well, the goal is to try and get you back to where you were 6 months ago, not 60 years ago. Okay? So if we can get you back to where you were 6 months ago, and you still have that typical backache that you had, then we've done our job. Sometimes we do it without an operation, sometimes we have to. So again, multiple patients, they can give you foraminal injections, they can give you facet joint injections or epidural steroid injections right into the canal itself. Doesn't really matter how they get there. The epidural injection right here is more of a shotgun approach. They just get the steroid into the spine, it kind of diffuses all over the place and kind of settles down. Whereas when they do the foraminal injection, they're only going to get one specific nerve. So sometimes I'll do that as a diagnostic test. Okay? We're not sure exactly which nerve is bothering you for sure, or whether it's being squeezed up above or down below. So we put the epidural steroid in, and you get somewhat better. Then we do this foraminal injection, and it takes it all away. Then we know specifically that's where the problem is. Okay? So we use it for both a diagnostic and a treatment modality.